The following portion of Mass Appeal is sponsored by Bella MedSpa.
A little lift, a little glow, and no surgery required. A trending treatment is helping people tighten and refresh their skin with minimal downtime. Here to tell us more is Dr. Craig Schacher, owner of Bella MedSpa. Thanks so much for being with us today.
Thanks for having me, Megan.
So let's talk about Attiva RF. What is that?
It's a new technology, a new device. You know, everything before was all about tightening the skin. And you know, we have a lot of people on weight loss medications and they're getting, you know, losing volume and getting a lot of descent and looseness of the skin. This is a new device that tightens a little differently. It doesn't just tighten the surface of the skin or the skin itself, but it tightens those layers underneath the skin, the ligaments, the fascia over the muscle, even some of the connective tissue between the muscle fibers. And so where other devices have been able to tighten, if you do 3 or 4 Morpheus or 3 or 4 Genius or laser or plasma technology, you can tighten maybe 10 to 20%. With this device, you can tighten more like 30 to 60% with just one treatment.
Wow, and how long does a treatment typically take?
It depends how many areas we're doing, but to basically do the full face and neck takes me about 35-40 minutes.
Oh, and then so how long is the minimal downtime that you have to spend before going back to work?
Generally, it's really well tolerated, this device, and usually there isn't much in the way of bruising or anything like that, so people can usually go back the next day. But there is one caveat. I would say when I'm tightening under the eyes, that's one area where about 10 to 20% of people get a bruise, and then they're covering that with makeup.
Can you tell I watch a lot of watched on TV?
Yeah, so that's one area where sometimes I have to be a little, you know, a little cautious about when they return to work in terms of looking their best.
So can you tell us how it works? I know you brought a display to kind of show us a better
it's
inside
amazing.
look.
ChatGPT made this in like 2 minutes.
Oh, that's incredible.
I usually drew it for patients, but basically this is a cross-section of the face and the skin is at the top. This is usually what we're treating with plasma or with radiofrequency topically or with a laser or with microneedling. And like I said, usually they'll do 3 or 4 treatments up here and they'll get about 10 to 20% skin tightening. If you look down here, there's a layer of fat and then there's a layer of muscle. And above the muscle is this fascial layer. And that's the layer that surgically, when they're doing facelifts, deep plane facelifts, they grab this layer and lift it up. But we've never really been able to treat it at all non-surgically. This device, I use a probe. Actually, this is capped. The probe is actually very, very thin. You can barely see it. And I anesthetize the skin and I go underneath. Let's see, I'll put that on so you can see it a little better. This is thicker. I go underneath the skin and I run in the fat layer and the energy goes into this fascia, tightens it up, tightens some of the connective tissue between the myofibrils and the muscle. And then I do a few layers like this and tighten these cutaneous ligaments. These are the ligaments that come from the fascia up to the skin. When we're young, these ligaments are like nice and short like this, and everything's nice and tight. But as we age, the ligament gets stretched out and stretched out and stretched out, as does the fascia and the muscle and the skin. So this, I go in, I tighten all this up, I go a few times to tighten all these ligaments, and then finally I go up into the skin to tighten that up.
Wow.
Yeah, with a 0.5 megahertz radio frequency, a really nice radio frequency that doesn't melt fat at all. So we run at a temperature of 42 to 49 degrees, which is really safe where people don't want to be losing fat, but tightens all these tissues. So again, you're sort of not just tightening the skin, but you're tightening all of that.
So what types of things can you treat for this? I know we've talked about the face, but are there other parts of the body?
Absolutely. I've been mostly doing the face, but you can actually do breasts, buttocks, arms, legs, really most of the body, hands. So really anywhere that there's skin, you can go underneath and tighten these structures.
Are hands kind of a popular one for the older population to kind of make them look a little bit more youthful and things like that?
It's definitely a up-and-coming thing. There are definitely some people as they're aging that are really interested in getting their hands to look younger. I wouldn't say it's the most popular yet, but it's definitely something that a lot of women are thinking about.
And so why is this different from other procedures?
Well, Like I said, it's a one and done for the most part. You're also going and tightening areas that never have been touched non-surgically before. So you're tightening this fascia, you're tightening these and shortening these cutaneous ligaments as well as the skin. So that's very different. And it's also, I think, probably the safest way we've ever done this before. The actual energy that they're using doesn't cause any scarring, any fibrosis, or any fat loss.
Oh, wonderful.
Yeah. So
if people want to know more about any of your procedures or this specific procedure, where can they go for more information?
If they want to know more, please call Bella MedSpa at 413-562-3552 or go to our website at mybellamedspa.com.
Well, thank you so much for telling us all about this procedure.
Thank you, Megan.
Thank you.
The preceding portion of Mass Appeal was sponsored by Bella MedSpa.